The chairman of the session, dear panelists, fellow researchers, my dear colleagues, I am pleased to convey my heartiest greetings to you all. Assalamu alaikum. Good afternoon. The present paper is a qualitative inquiry on the social and economic impacts of COVID-19 on Sri Lankan working mothers in Bahrain. 2019, the world has been encountered severe health, economic, and social crisis due to the coronavirus disease. Due to the pandemic panic, as well as the preventive measures implemented by the states, companies and house owners stopped the minor workers from entering their premises. Among them, foreign domestic workers are a vulnerable group who have been experiencing a significant loss of employment as observed in Hong Kong. Sri Lanka is a labor-sending country. Particularly, 80% of the female had been employed in the Middle East countries. According to the Parliament report of Sri Lanka, by January 2021, nearly 34,000 Sri Lankan Middle East workers were lost their jobs due to the COVID crisis. Historically, a similar tragedy was encountered by the Sri Lankan migrant workers during the Gulf War in 1990. However, the experiences of the migrant workers during the COVID pandemic have not been received much attention from Sri Lankan researchers as much they did during the Gulf War. The present study aimed to explore the work tragedies and living conditions of Sri Lankan working mothers during this unprecedented COVID-19 health context. Sri Lankan freelance working mothers staying with their families in Bahrain are referred to as physically present workers in lowly paid work, such as housemaid and nannies, as part-time for single and multiple employers. Literature on Sri Lankan migrant workers during the pandemic. The report regarding Sri Lankan skilled migrants, based on the multiple destinations, including Western countries, emphasized that the portion of migrants face work-related problems such as loss of employment, non-payment, or delay of wages due to this pandemic. More specifically, the study in Qatar revealed that semi-skilled workers struggle to send remittances, pay debts, and afford food and daily other expenses. Further, the study emphasized that accumulated savings were the blessings to cope with delayed payment for skilled and highly skilled professionals. Both studies are biased with semi-skilled, skilled, and highly skilled workers. However, the COVID crisis, COVID experiences of low skilled and freelance working mothers who stay with family in the destination have not been received much attention in the previous works. The present paper considers that the working mothers and their families qualitatively differ from the individual and skilled workers because expenses are comparatively high for their accommodation, medical, utilities, and food. The present slide talking about the methodology adopted to this study. The qualitative research method was utilized: drawing, descriptive analysis, a thematic analysis technique of compiling data by semi-structured interviews. The informants of the present study were working mothers who had resided with families in Bahrain for more than 6 months. The sample was collected using the purposive sampling method and snowball technique. Data were collected using in-depth interviews, an average of 45 minutes of duration. The interview lasted from August 2020 to April 2021. The present research used an online platform, Zoom and WhatsApp. During the data analysis, a digital method, particularly Atlas TI, was used. The present study used a thematic approach to present the findings. The table displayed in the present slide shows the characteristic of the informants. 10 out of 11 families had resided in sharing and self-rented houses. Most of them engage in precarious jobs such as maids, childcare, taxi riders, and daily paid work. But they were unemployed during the interview except two mothers. Three families had left their children behind, and the rest of the families lived with their children in Bahrain. Three mothers were without male companionship due to the separation of husbands. The following few slides talking about the discussion of findings. 33 codes were identified in the data analysis, and those codes were grouped into four theme groups to present the findings in detail. The first part of the findings highlights their work tragedies during the COVID-19 under three themes. These themes cover how the prime earning source of working mothers in Bahrain was collapsed after the arrival of COVID-19 crisis. The following themes describe their living conditions. Mainly it shows how was their pressure to work due to hunger, accumulation of house rent and utilities, and increasing pressure of sending money to their families left behind. The next part, even though the pressure of work was existed, the unprecedented COVID crisis and the family structure of some mothers did not allow them to work, which are described in the next section under three themes. The final part describes how they cope with these social and economic tragedies. However, this section reached with only two themes based on the data collected. Work experiences shows worker families who have experienced work termination during the pandemic were non-contract workers. Some employers detained the salary of undocumented mothers. Suspended mothers were contract workers. Some were paid a few amount of money and some were stopped without payment. The study found that the working sectors of the freelance mothers were precarious and collapsed. Some of them had less power to negotiate with employers. In that, Sri Lankan domestic laborers work in the least protected sectors. Working mothers said that they want to work. Termination and work suspensions impacted their family savings and expenses. However, their daily needs, payments, and debts remained the same. Terminated workers entirely lost their earnings, while suspended mothers received enough to cover their food. However, the amount they received was not enough to cover all their payment and expenses. Still, some mothers were compulsive to send their money to families left behind, and repaying debts were another pressure for working mothers. Even though the pressure of work was existed, the unprecedented COVID crisis and the family structure of some mothers did not allow them to work. First, some mothers were engaged in unstable job they need to find every day. Second, the family responsibility of mothers was higher than before. For example, females without male companionship were fully committed to caring for their children. Some others dropped their job due to the health concern, and they were cautious about spreading the virus among the family members. It is worth noting that increasing financial need and worry about the family members left behind create mental illness among migrant workers. Receiving help was only the coping mechanism that they adopted. Although they had the problem, undocumented migrant mothers were less likely to expose to the public due to their legal status, such as visa. The present study concludes that the working sector of the freelance mothers were precarious and collapsed during this pandemic, in that they became more vulnerable than before. Health was the primary concern of the employers and working mothers to recruit workers and withdraw from the work. Most families spend their money around the destination as they depend on their salaries for following their food. Eventually, they did not fulfill their migration objectives of earning money and living peaceful life in the receiving countries. Coping strategies were not properly adapted by the working mothers. The present study suggests that the studies can cover the coping mechanisms adopted by migrant workers, especially during the tragic situation such as COVID-19. That's all. Thank you so much.